But my name is Casey Canfield. I'm an assistant professor in engineering management and systems engineering at Missouri University of Science and Technology. And so I'm leading this project. And so we're very excited to give you all an update on what we've been up to so far. So as most of you are aware, and as you can see in this plot, kidneys are the most transplanted organ. However, the demand for kidney transplants, which is shown in the blue bar, is much higher than the supply, as shown in the black bar. So in 2022, almost 24,000 candidates received a kidney transplant, but there's still about 90,000 candidates on the wait list today. Unfortunately, thousands of kidneys from deceased donors are not used every year, and some of this is for medical reasons, but there's also logistical challenges. So some of those unused kidneys are probably missed opportunities. So this plot shows the non-utilization rate in the blue line on the bottom. So as the kidney donor profile index, or the KDPI, increases, the kidney quality decreases, and it's more likely that the kidney is not going to be used. However, the green line here at the top shows the graft survival and is actually pretty flat. So this suggests that people can actually have positive outcomes with these high KDPI kidneys. And so it's worthwhile to try and figure out how to get them transplanted. And so this is where we're starting to wonder, maybe AI can help. So we're going to be talking more about the AI system that we're developing, and we're really eager to get your feedback on it. So we also want to acknowledge that there is unfairness in the existing system, and it's our job to make sure that the AI system is not perpetuating any unfairness or discrimination. So this is a plot about racial bias, and it shows that white people in the blue line at the top are more likely to get transplanted preemptively than people of other races. So we know that there's a lot of reasons, both medical and otherwise, for this disparity. And we're going to be talking today about the research that we're doing to try and make our AI system fair. So just as a heads up, we are actually going to be launching 2 surveys in the next month or so. And one of them is focused on learning how you all want to define fairness. So we have been working on this for a while, since 2019. So in 2020, we received a planning grant from the National Science Foundation, and many of you who are here today participated in the stakeholder engagement that we conducted. Over the course of the year, we conducted interviews and workshops to learn about the existing transplant system and design what we have so far. So I just want to take a moment and thank everyone who participated in that process to represent the Transplant Center, Organ Procurement Organization, and transplant recipient perspectives. We really, really appreciate all the help and support so far. So the goal of these webinars is to keep you updated on where we're going. So based on what we learned in the stakeholder engagement, we are targeting this AI system for places where there's tension between transplant professionals. So the basic idea is that on the OPO side, they're trying to find a home for a donated kidney. So it would be better for OPOs if transplant centers denied kidneys sooner if they're not going to ultimately transplant it. So there's 2 moments where we see the AI system fitting into the OPO side. One is identifying whether a kidney is hard to place, and then the other is figuring out which transplant centers to target for a particular kidney. However, on the transplant center side, surgeons don't want to miss out on a successful transplant. So there's a tendency to provisionally accept kidneys, even if it's very unlikely that it'll ultimately get transplanted. And so we're anticipating this AI system is going to be involved in helping evaluate the kidney offer, whether that's a surgeon or anyone else who's involved. And then while we're not developing anything that's patient-facing at this point, we obviously want to make sure that the transplant recipient perspective is represented in the design of this system, since that's who's ultimately impacted. From all the conversations that we've had so far, we know that there's a lot of opportunity to build tools for patients, and so we hope to do that in the future. So last year, we received additional funding from the National Science Foundation to continue this project, and we're going to be continuing to work on this through 2026 at least. So this diagram represents the full project, and we're going to be giving you updates on the progress we've made so far. So first, we're going to talk about the AI system and those two use cases that I mentioned for the Transplant Center and for the OPOs. We're going to talk about the interface for the AI system and what information to communicate to the user. We're also thinking about the roles of preferences. And so we will be talking about some data collection that we're going to be launching in the next month or so related to adoption and fairness. We have lots more work to do. And so this whole thing is going to culminate in an evaluation using UNOS Labs Simunet, which is a simulated donor offer system for conducting behavioral studies. So far they've built out the transplant center side of it, but we're going to be expanding the OPO side as part of this project. So as you can see, this is a really big project that involves a lot of people. We have team members from Missouri S&T, St. Louis University, and United Network for Organ Sharing. So today you're going to be hearing from the students who are leading this work on a daily basis. We meet as a full group every week to make sure that everyone on the team can provide input on the sub-team work that we'll be presenting today. But we know the transplant system is very complicated. We're always learning more about it. And so we really need your input to make sure that this work is relevant and impactful. So please add any questions that you have to the Q&A. That is my best recommendation for making sure that it's easy to find the questions and the answers. We're going to be focusing on 4 sub-teams today. I am recording this webinar, and so it will be available on our website publicly for reference in the future. I'll also post the slides. But because of that recording, that's why we want to hold all discussion of the questions to the very end. So we'll be able to respond via the Q&A and the chat. We're happy to stick around at the end of the hour if there's additional questions and comments. And so once we get to the end, there is some functionality for being able to raise your hand, and then we can make it so that attendees can talk. Okay, so with that, I am going to hand it over to Richard to talk about Offer AI.
Good evening, and again, thank you for joining us to hear about our update for artificial intelligence and kidney acceptance. The feedback is invaluable and will help us build a better AI. My name is Richard Threlfeld, and I'm excited to share with you our artificial intelligence platform, Offer AI. Our sub-team consists of 4 members. Dr. Dogley is the co-principal investigator for the project and is a professor in the systems engineering at Missouri University of Science and Technology. Dr. Ishiku leads the algorithm and artificial intelligence research and is research associate in systems engineering at Missouri University of Science and Technology. For myself, I lead the digital twin, which is a digital representation of the organ transplant system, simulation and integration of the AI. I'm a PhD candidate in systems engineering at Missouri University of Science and Technology. Last, Rachel leads the AI human experiments and is a PhD student in systems engineering at Missouri University of Science and Technology. First, let's discuss what is artificial intelligence, commonly referred to as AI. AI, machine learning, and deep learning are often used interchangeably to describe various algorithms that are trained on data in many domains. Machine learning can learn and operate on larger data sets and typically require shorter training times. Deep learning captures nonlinear or complex correlations for very large data sets, including images like classification or identification of objects such as cats and stop signs. The deep learning algorithms generally yield better performance than machine learning. Artificial intelligence is used in many domains, such as financial, transportation, medical, and retail, to assist decision makers. We want to use it ourselves to help decision makers make better decisions and identify those missed opportunities of possible kidney transplants that was mentioned by Dr. Canfield. Offer AI is a platform that will assist organ procurement organizations and transplant centers in decisions about kidney transplants. First, we have the deceased donor organ assessment, which helps OPOs, or organ procurement organizations, identify hard-to-place kidneys. This model is trained on Organ Procurement and Transplantation Network, or OPTN, data. This model will help identify hard-to-place kidneys. A hard-to-place kidney is a kidney at high risk for non-utilization. As Dr. Canfield mentioned earlier, these hard-to-place kidneys can still be used in the right patient and have low graft failure. This model has been developed and a web version is available for you to use. I'm going to actually put the link into the chat right now for everyone to see. And we invite you to use the application and provide feedback to us. If something doesn't make sense or you get a result that you wouldn't expect, please send us an email or put your question into the Q&A and we will answer your questions. Additionally, 2 artificial intelligence models of provisional acceptance and primary acceptance have been developed and are soon to be implemented. These algorithms assist the surgeon in accepting kidney offers from the OPO and use an optimized genetic deep learning algorithm. If you'd like to learn more about how the model was developed, we provide a citation to the research paper at the bottom of the slide. Now, AlphaAI can assist decision makers in the kidney transplant system at a given time, but the kidney chance of non-utilization can change based on additional information that's received about the kidney, such as biopsy information. We have partnered with Mid-America Transplant to develop OPO AI that integrates artificial intelligence and can support decisions over time on kidney allocation within the OPO. The OPTN has policies and gives the OPO a match run list that they must follow, but especially for hard-to-place kidneys that are high risk for non-utilization, the OPO can conduct an out-of-sequence placement. An example on the right that shows that initial candidates A through D have declined the kidney offer, but the OPO can go out of sequence to candidate W to ultimately use the kidney. Offer AI in the simulation will help the OPO identify candidate W earlier in the process and have a better chance to utilize the kidney for transplant. A few questions we consider when we are debating on going out of sequence is the kidney considered high risk for non-utilization, or is it hard to place? Has the kidney been declined by many transplant centers? What is the likelihood of being accepted for transplant? This simulation and integrated artificial intelligence are in development and testing is occurring for another year with Mid-America Transplant. If you're interested in learning more, please see the side research paper at the bottom of the slide. We also know that these decisions come as a combination of individual practices and processes, technology, and AI algorithm support. So we're designing and conducting experiments in the next year for the application and measurability of Offer AI models. We will evaluate the inherent bias of the algorithms. And as an example on the right with diabetes, it's important to measure the limitations and bias of the model to ensure a statistical fair representation of all populations and features to minimize bias within the Offer AI models. As Durrington says in his TED Talk, that decision-making ultimately comes 70% from people and processes, 20% from technology, and 10% from the algorithms. Thus, we are designing human AI teaming experiments to ensure Offer AI assists in decision-making in an optimized and informed method. In the next year, we will continue to collaborate with stakeholders to gather feedback to improve our Offer AI platform and simulation software. We will integrate the accepted models for transplant centers into an online platform. We continue to conduct testing with stakeholders, decision makers, and users, and studying human AI collaboration to understand the decision-making moves and preferences of individuals. The balance of utility and performance versus the equity of healthcare is important to all of us. So Offer AI must go through extensive testing and feedback from all of you to create a better software system to identify those missed kidney transplant opportunities. Now that you know about Offer AI and the simulation software, it is important to ensure these AI decision aids are trusted by the community and transparent in explaining how they are trained and what data is needed by the decision maker. I'll be handing it off to Harry to talk about researching the usability and explainability of artificial intelligence.
Thank you, Richard. The goal of usable communication is to identify effective ways of representing AI predictions and operations to users so that task performance, user trust in the system, and user adoption of the system improves. I'm Harishankar Subramanian, a PhD student at Missouri S&T. I work under Dr. Casey Canfield and Dr. Daniel B. Schenk. Our research is focused on human factors and AI communication. So we conduct experiments investigating the effective methods to communicate AI operations and transparency features to end users. An effective decision support tool should be explainable. AI has increased in multiple sectors, including healthcare, but users are often left with questions on how the AI came up with a prediction, when is the AI right or wrong, or when to rely or not rely on its predictions. With the explainable AI, the goal is to help users understand the system's process and logic, when to trust the system, and consecutively effectively manage task performance. In the usability context, we plan to conduct multiple human subject studies. These experiments will focus on uncertainty representation and AI's explainability in terms of how they influence AI trust, user confidence, task performance, and user adoption. The results of these human subject experiments will help us in designing the optimal interface for Offer AI. Following the stakeholder engagement workshops, where we collected information on preferences towards AI predictions and the explainable AI interface, we conducted a scoping literature review. By contextualizing the findings from our stakeholder engagement with the scoping literature review, 4 key themes emerged: contextual use of AI predictions, information that should be included with AI predictions, personalization of AI predictions for different groups, and customizing AI predictions for specific cases. Stakeholders need both system level and prediction level information. System level information helps users develop a mental model of the system, whereas prediction level information helps users make decisions and understand the credibility and utility of the system. There are multiple methods to represent both system level and prediction level information about the AI. So let's start with the system level information. At the system level, the information should describe and explain Offer AI as a whole. So these measures should go beyond just providing the accuracy of a system. And today I'll be showing 3 different of such measures. First up is confusion matrix. A confusion matrix provides detail on the performance of Offer AI. For example, the Offer AI was trained on historical kidney allocation data, and the top left box tells us that the Offer AI correctly classified 5,272 offers to be transplanted. Similarly, it correctly identified to not transplant 5,170 kidneys as historically decided, which is shown in the bottom right box. The other 2 boxes show the errors made by the AI. Historically, 343 kidneys were transplanted when the Offer AI incorrectly predicted to transplant them, and 49 of the kidneys were transplanted in the historical data when the Offer AI predicted to not transplant them. So this simple graph shows how well the Offer AI functions based on the data it was trained on. Next up is feature importance, which is another system level information. This shows the participants the contribution of each feature to the prediction, and it is based on the whole data set. In this illustration, the Offer AI shows us that in general, PTR score, or potential transplant recipient's total score, has the highest contribution to Offer AI's prediction, followed by donor HCV status, donor serum creatinine level, donor's age, and cost of death. So depending on how a model was trained, the magnitudes represented in this graph here can change as well. Lastly, we can also provide information on how the model was trained. Here's a simple representation showing that the Offer AI was trained on data collected from 2016 to 2021, which included a total of 1.3 million observations and 29 features. Training information can further reveal what the features are, their lower and upper limits, and much more. So system level information provides detail on how the Offer AI was trained as a whole and how it functions or operates. Literature shows us that system level information is critical for users to build an appropriate mental model of the system and to understand the system's capabilities. Next is prediction level information. These are information provided for every use case you will review. In other words, prediction level information are details provided by the Offer AI for reviewing each kidney offer. Literature shows that in general, prediction level information improves trust and performance. However, how much it affects depends on the task as well as the individual. There are many ways to represent prediction level explainable AI information as well. One explainable AI measure is the counterfactual, which shows what needs to change in the use case for the AI's prediction to change. For example, in this scenario, what you see in the box, Offer AI predicts to transplant the kidney. The explainable AI measure provides detail for when it would predict the opposite. If the donor serum creatinine was 2.0 instead of 1.1, the Offer AI would predict to not transplant the kidney. Another prediction level information example is nearest neighbors. The figure here shows that the current kidney offer and then compares it with alternate kidney offers. The explanation here shows that the current offer's prediction is to transplant, which is based on 1.1 serum creatinine, donor age 65, and HCV status negative. These alternate cases show how would the prediction change if only one attribute changes the value. So both these explanations actually shed light on the operations of Offer AI and how it will behave for different offers, which can further improve users' mental model of the system and help in decision making. Providing the appropriate system level and prediction level information is only part of the challenge. Providing the right level of information based on task complexity, users' preference, and users' expertise is also an area that needs further research. In general, literature suggests that users want more explainable AI information for difficult decisions. This is in line with our findings from the stakeholder engagement, where people prefer to view less explainable AI information for easy kidney offers and more detailed explainable AI information for a high risk or a hard to place kidney offer. Literature also shows us that experts prefer to receive both a conservative and a liberal prediction for difficult decisions, like experts asking for a second opinion. Depending on the task and the expertise level, there's a need to identify the right amount of explainable AI to provide. The level of explainable AI information provided could vary from case to case and from user to user. Literature in general suggests that customization improves initial adoption and trust. Currently, there's a lack of strong empirical evidence on the benefits or drawbacks of customizing explainable AI interface according to user needs. So with the information gathered from our stakeholder engagement and the scoping literature review, our main goal of our future work is to empirically understand how end users interact with decision support tools like Offer AI. So moving forward, we want to address the gaps found in the literature and validate the preferences to explainable AI that was found both in the literature and from our stakeholder engagement events. Our future work as part of the usable communication agenda will include investigating how user trust and task performance is affected. And it will be done through human subject experiments. And we'll look into how is user trust and task performance affected when system level information is provided, either by itself or with prediction level information. Secondly, how trust or performance is affected when user has control over the XAI interface or the explainable AI interface. And lastly, our future work will also investigate the effect of user expertise. How is the task performance and user trust affected when we tailor the explainable AI features based on user needs? To conduct these human subject experiments, we need an analogous task that is like transplant placement, but a more common activity. This will minimize the number of experiments that we need you all as members of the transplant community to participate in. To mimic the kidney Offer AI characteristics as closely as possible, the analogous task must have people with varying levels of expertise that we can measure, data or information provided in a table format, so image-based tasks are not ideally suitable, and a predictable outcome that is not completely random. And finally, a subjective truth, where people disagree about the best choice to make. One idea that we have is a used car analogy, since more people have experience buying cars. The idea here is to mimic the matching of a right used car with an appropriate potential customer. The data is provided in tabulated form or in table. There's a predictable outcome and a subjective truth. We can also measure expertise through car-related questions and their occupation. This is just one example of an analogous task. Currently, we're brainstorming and researching multiple other suitable tasks. So if you can think of a better analogous task, please do let us know in the chat. And if you have ideas on how we can best use the used car analogy as well, let us know again in the chat. And that's all from the usable side. So now I'll hand it to Elham for adoption.
Thank you, Harry. Good evening, everyone. In this part of the presentation, I'm going to talk about Offer AI adoption on the survey in this project. My name is Elham Babai, a master student in industrial organizational psychology. I'm working with Dr. Canfield and Dr. Shang. I also want to thank Dr. Ebrol and Dr. Miller for their collaboration in this part of the project. The first survey in this project, which I'm going to talk about it, is about investigating users' interest and intention to use Offer AI. You will have more information about the second survey in the next part of the presentation. In 2019, a few researchers discovered people are more reluctant to use an AI system that neglects their uniqueness. We know that not all users are the same. For example, users may differ from each other in terms of their risk posture. Maybe you are a risk-taker person, but another one is a risk-averse person. These differences suggest that everyone should be able to customize and integrate their preferences into Offer AI and get different predictions. Also, it is important for Offer AI to consider these differences in order to be accepted. Another fact is that we know from research that AI is perceived as morally wrong if they do not offer a fair and unbiased predictions. However, researchers indicated that if users can make just a slight changes, those users continue to use the AI system. So in this project, we believe that for Offer AI to gain acceptance, it should be adaptable to user preferences and responsive to their needs. We also are trying to integrate user preferences into operation and communication in order to minimize human efforts. For meeting this perspective, there are 4 stages that need to be considered. First, we plan to develop a stakeholder survey. We are currently working on this step. The survey is going to be deployed among 4 different stakeholder groups. We want to make a comparison across the stakeholder groups about their interest and intention to adopt Offer AI. I will talk about the survey in the following slides. In the second stage, we plan to develop system-level training materials. As it was explained, the training materials will cover both general information about the AI model and specific explanations for predictions. Providing training materials directly into Offer AI ensures that the training information is always available. It is customizable for users' needs and also adaptable over time. It also can help users comprehend how the model's operation aligns with their own decision-making process. In the third stage, we plan to conduct a customization experiment. By doing so, we test whether having control enhances trust and use of Offer AI. Plus, we will test whether customizing the model to be better match the user decision-making process improves performance, trust, perceived usefulness, and behavior. And finally, as additional inputs to the model, we'll employ the preferences that are captured from the survey tools and use behavior. To develop the survey, we are using technology adoption theories. There are several theories regarding technology acceptance. Each theory introduces factors that might affect the user's intention to perform a specific behavior. These models can help researchers to predict the behavior and provide a theoretical explanation for the successful implementation of technology. For example, as you can see in the screen, a technology adoption theory claims that expectations about technology performance, expectations about users' effort to use the technology, and the effect of other people or other restrictions surrounding users influence the adoption process. Having this in mind, we plan to develop the survey in order to discover some potential barriers and challenges during Offer AI. This can help organ procurement organizations and transplant centers to prepare required changes before implementing Offer AI. As I mentioned, we plan to distribute 2 surveys. This is the first survey. We hope to see your contribution. This survey is going to be distributed among 4 different stakeholders, which are public, candidates, OPO staff, and transplant surgeons. We want to make a comparison across the stakeholder groups. The main purpose of conducting this survey is measuring each stakeholder willingness to adopt Offer AI. We also plan to collect some information for ethic notions. And finally, some demographic information will be collected at the end of the survey. Recruitment method for each stakeholder group is different. The recruitment method for the general public is a website called Prolific, which is an online participant platform. For the patients, we are hoping to distribute the survey through American Association of Kidney Patients and the National Kidney Foundation. For OPO staff, the survey will be distributed through the Association of Organ Procurement Organizations. And finally, American Society of Transplant Surgeons and American Society of Transplantation will help us to distribute the survey among transplant surgeons. The plan for deployment and distribution is within 1 month. We appreciate your contribution in this survey. Your contribution will help us to have more accurate information in identifying potential barriers and challenges. Or we can figure out if there is an institutional change that needs to happen. The information are necessary for successful implementation of Offer AI. You may also leave a text in the question and answer if you think of any other association that can help us distribute the survey. Thank you for listening for this part of the project. I'm going to pass it to Mukan to inform you about the fairness.
Oh, thank you, Ilham. So our team will be focusing on fairness aspects in kidney placement. So I'm Mukund Thelikunta. I'm a PhD student under Dr. Sid Nalimla. And we also had 2 interns over this summer, Gabrielle and Sukrit. So to begin with, let's discuss about a few instances of discrimination in kidney placement. For example, Black patients had higher creatine levels. And as a result, while calculating the creatine-based eGFR scores, Black patients are biased towards in this calculation. And another instance is where Black donors have historically been shown to be associated with lower allograft quality, and consequently, while calculating the KDRI score, the Black patients are biased towards this score computation. Also, women with primary diagnosis of diabetes was significantly higher than females, leading to higher health risks. And also, not all care centers have access to enough resources necessary to perform mandatory medical evaluations. So there are several such discriminations instances observed in current kidney placement process, which needs to be addressed. So recently, several researchers have proposed or designed AI-based decision support systems to help doctors and transplant surgeons make better decisions regarding the kidney offers. One such example is the UNOSA's predictive analytics tool, which was recently released in January 2023, which provides 2 different information The first one is the time to better offer, and the second one is the patient survival without transplant. So as you can see, a small graph on the right, where the patient survival is being decreased as the years pass on without any transplant. So such analytics can be helpful for surgeons or doctors, help to make better decisions regarding the kidney offers. However, such models are trained on historic data, which are susceptible to inherent biases or discriminations, which I was explaining in the earlier slide. Another example is the Offer AI, which was explained in detail by Richard. Even though this Offer AI is designed based on different model, a neural network based model, this has been trained using historical data. And again, historic data is susceptible to inherent biases and discrimination present in the data. So the objective of this project is to measure or evaluate fairness of such AI-based decision support systems used in kidney placement. So there are two different ways to measure discrimination or measure fairness. The first one is disparate treatment, which asks a simple question: are similar individuals treated similarly? One such example of individual disparate treatment is individual fairness, which can be defined as if two individuals are similar, their outcomes should also be similar. On the other hand, we have disparate impact, where it asks, does individuals across different social groups have similar outcomes? The groups can be two different races, two different genders, or two different age groups. And one such example of disparate impact is group fairness, which ensures equal parity across two different groups. From the birth of fairness, there has been a fight between accuracy and fairness. Accuracy focuses on decision correctness, whereas fairness focuses on social discrimination. And there is a well-studied theory that says that as the fairness of a model increases, its accuracy tends to lose. So is there a way that we can mitigate discrimination or biases in an AI-based system with no compromise on accuracy? So due to various challenges involved in individual fairness, like defining what similarity metric between two individuals, we will only be focusing on group fairness notions across different groups. So there are several such group fairness notions proposed over the past decade. We have three such group fairness notions on the slide here. So let's go ahead and define two different confusion matrices, one above and one below, one for each group. And again, the two groups can be two different races or genders. So confusion matrix is used to compare the decisions made by the AI tool compared with the original decisions taken by the surgeon in reality. For example, in the first quadrant, if both AI tool and the surgeon decides to transplant the kidney, we call it as true positive, or the first quadrant in that matrix. And one such notion is equal opportunity, which says that both the groups A and A prime should have equal true positives across them. Another such group fairness notion is equal accuracy, which requires not only true positives, but also true negatives, where both the AI tool and the transplant surgeon decides to not transplant the kidney. And there are several such group fairness notions in the literature, 25 specifically. And there is a well-known study that says that not all fairness notions can be guaranteed at the same time unless the base rates are equal. That is, the fraction of individuals receiving transplant should be equal across two different groups, or else the AI model does not make any mistakes, does not make any errors, which is highly impossible in reality. So an important question that arises here is, which of the group fairness notions should be selected to evaluate AI tools specifically in kidney placement? So that's where our survey number 2 comes into the picture. The goal of this survey is to collect fairness opinions from diverse stakeholders and identify that single group fairness notion that can be used to evaluate the AI tools. So in kidney placement, there are 2 different groups of stakeholders. One where the stakeholders with clinical expertise, which involves surgeons and organ procurement organizations, who possess extensive clinical knowledge and usually recommends final decisions regarding the kidney offer. On the other hand, we have stakeholders with personal experience, which involving patients, donors, their families, and friends, who possess rich personal experience from being involved in this kidney placement process. And usually they are the ones who decide, ultimately decides based on the surgeon's recommendation. So there are 3 important steps in this survey. The first one is to design a fairness survey and collect feedback from diverse stakeholders. Then we hope to estimate the preferences across different group fairness notions. And finally, we want to aggregate these preferences and identify a socially acceptable group fairness notion to evaluate the AI tools. So please let us know if you have any questions regarding the survey or fairness. And thank you.
Thanks, Mukund. So those are the 4 updates from the sub-teams that we have today. Just to give you a reminder of the full scope of this project, like this is just us getting started. We'll be working on this for the next several years. And the goal is to have something that could theoretically be implemented by the end of this. So that's what we're really aiming for. And then at this point, we are happy to open it up for questions and comments. So you can go ahead and continue putting stuff in the Q&A in the chat. You can also raise your hand and I can make it so you can talk. If there's stuff you'd like to discuss, we'd be happy to discuss. A couple things I just want to make sure everyone is stay tuned for. One is keep an eye out for these stakeholder surveys that are going to come out. So one is going to be about adoption, and then the other one is going to be about fairness. Also, if you have any thoughts about how we can do a better job distributing those surveys, we're very eager for feedback. Also, Richard posted the link for Offer AI, the prototype that we have so far, in the chat. So we'd love to get your feedback on it. And then one thing we haven't mentioned yet is that we are planning to host an ethics symposium at St. Louis University, and that's planned tentatively for fall 2024. So it's a year away, so a lot of time to get prepared for it. But that's another opportunity to really sit down and think about, what's an appropriate role for AI in the kidney transplant process, and especially in the placement process that we're focused on.